Hey everyone, for this week's case study, we're doing Guillain Barre. CM is a 54-year-old female who presents to an urgent care via wheelchair with reports of worsening lower extremity weakness and paresthesia to her hands and feet that started 3 days ago. The weakness has gotten worse, and now she feels that she's unable to ambulate. She's typically healthy, active, and has never required a wheelchair for transportation in the past. She has no pertinent past medical history. She reports having the flu about a month ago, but she says she is completely recovered and was not very ill at the time. Her vital signs are stable. She's not experiencing any symptoms aside from bilateral leg weakness and numbness and tingling to her hands and feet. On exam, CM has decreased deep tendon reflexes in bilateral lower extremities. Her strength in bilateral legs is 3 out of 5, but she does not have decreased sensation. You notice her speech is a bit off, and she admits that she is having some difficulty accentuating her words. Otherwise, her neurologic and physical exam is benign. Given her recent viral illness and presentation of bilateral leg weakness and paresthesia, you suggest transfer to an emergency department for a complete neurologic and infectious workup. You tell CM that you are concerned that she has developed Guillain-Barré syndrome. The infectious workup will include a complete blood count, a complete metabolic panel, and electrolyte sedimentation rate. These tests will likely be non-conclusive and are used purely for exclusion criteria of another cause of weakness. She'll also need a lumbar puncture to rule out meningitis. An electrodiagnostic study of nerve conduction will be performed to assess the extent of demyelination and confirm the diagnosis of Guillain-Barré. Treatment of this is supportive, and in the incidence of progression to the diaphragm, she may need to be intubated for respiratory support. Intravenous immune globulin, or IVIG, is a treatment option that's used in severe cases to avoid respiratory compromise. I hope this was helpful.